Today, I wanted to talk about something that so many women struggle with, but very few get answers for: endometriosis. Hi, I'm Dr. Behnaz, a pelvic floor specialist. Maybe you know this story too well. Month after month, your period leaves you curled up with cramps that are so strong you can't think straight. Maybe intimacy is painful, or you feel sharp bladder or bowel pain during your cycle. Too often, women are told this is just part of being a woman. But I want you to know this pain is real. It has a name, and there are treatments that can help. Endometriosis happens when tissue that usually lines up your uterus grows in place it doesn't belong, like your ovaries, your bladder, or your pelvic walls. Every month, this tissue still reacts to hormones, but because it has nowhere to go, it causes irritation, inflammation, and sometimes scar tissue. That's what makes the pain so deep and long lasting. The most common things I hear from women with endometriosis are cramps that are far worse than what their friends describe: deep aching in the pelvis, pain during intimacy, pain when using the bathroom during the cycle. Sometimes the pain even spreads into the back or hips. Now let's talk about what we do about it. Treatment for endometriosis is usually a team approach. Medication or surgery may be part of it, but pelvic floor therapy is where you learn the everyday tools that put some of the control back in your hands. Here's what we focus on in therapy and what you can start practicing. So the first thing that I want you to do is breathing technique to relax your pelvic floor. With endometriosis, your pelvic floor muscles often tighten up, like they're always on guard. That constant bracing actually makes the pain worse. So I'll guide you into a simple routine. Lie on your back with your knees bent and one hand on your belly. Inhale slowly, let your belly rise, and imagine your pelvic floor melting down and softening. As you exhale, keep it relaxed. Just 5 minutes of this each day helps your body unlearn that constant tension. On days when the pain is at its worst, I show women how to use positioning like medicine: curling into child's pose, gently hugging the knees into the chest, or lying on your side with a pillow between your legs. These aren't just stretches. They're positions that let your pelvis rest. Find the one where your body sighs with relief and use it as often as you need. We add in movements that calm the hips and low back, since tension there feeds into the pelvic pain. A figure 4 stretch can open tight hips. Cat-cow on hands and knees helps the spine and pelvis move more freely. Happy baby pose, lying on your back and holding your knees, gives a gentle opening through the pelvic floor. Even a small pelvic tilts or letting your knees sway side to side on your back can reduce the stiffness. These aren't workouts. They're reminders that your body can move without pain taking over. We do also scar tissue work. If you've had surgery, maybe a laparoscopy or C-section, scars can stay stiff and pull on tissues inside. In therapy, I use gentle hands-on techniques to free up those restrictions, and I teach women how to do light scar massage at home. Just a little circular motion or sliding the skin side to side can reduce that tugging feeling over time. So let's talk about comfort tools you can use anytime. Heat is simple but powerful. A heating pad on your belly can calm cramps and muscle guarding. A wedge or donut cushion can make sitting easier. Some women put together a flare-up kit. Their heating pad, cushion, breathing exercise, and even a calming playlist. That way, when pain spikes, they know exactly what to reach for. We also look at small things you do daily that can either help or hurt your pelvis. On the toilet, for example, placing your feet on a small stool, leaning forward slightly, and breathing instead of straining makes bowel movements easier. If you sit a lot for work, standing up every 30 to 40 minutes keeps your muscles from locking up. And when lifting, instead of holding your breath and pushing down on your pelvic floor, I teach you to exhale gently. It protects your body. I want you to know your triggers. Every woman's flare pattern is a little different. That's why I encourage women to keep a short diary. Write down the day of your cycle, what you were doing, and what the pain felt like. Maybe a straight makes it worse. Maybe long sitting or constipation triggers it. Once you see your patterns, we can create a flare up plan together. So you'll know exactly which stretch, which breathing exercise, or which positions works for you. One of my patients had lived like this since her teens. She thought it was just her normal. She avoided intimacy, missed work, and built her life around flare days. We started a small belly breathing, gentle stretches, scar release treatments, comfort positions. She made her own flare kit and tracked her triggers. A few months later, she came back and said, for the first time, I feel like I'm in charge, not my pain. If you live with endometriosis, I want you to remember this pain is real and it's treatable. Pelvic floor therapy doesn't mean just one thing. It means a collection of small practical tools, breathing techniques, stretching, scar release, comfort strategies, and flare up planning. Used together, they give you back a sense of control over your body. You don't have to live in silence. Relief is possible. If you found this video helpful, please subscribe to my channel, hit the like button, and tap the notification bell so you don't miss future pelvic health videos. Together, we can spread awareness and help more women find the care they deserve.